Welcome, beautiful, beloved souls. As you know, today is a day for me that comes around every year since 6 years ago. Robbie died, and grief never goes away. But I wanted to try and continue and do another commentary. For those of you who are new, I do mainly commentaries that don't fit a particular topic. I look at anything and everything through a lens, and my name is Gemstone. I'm a psychic medium and I'm an author. All right, let's get into my commentary. And the title is The Alchemy of Pain, What My Dental Trauma Taught Me About Fear, Control, and Healing. Last Friday, and today is Monday the 20th, I went in on the Friday for what I thought was a simple dental filling. No pain, no urgency, just something that needed doing. Within 24 hours, my face was swollen, my eye felt affected, and I was sitting there thinking, how can something so small turn into something this serious? And you can see I'm having trouble talking. And that question opened something much bigger, because this isn't just about a tooth. Part 1, the real experience. I'm 65. I've had fillings most of my life, like many of us from that era, back when materials weren't what they are today, and we were told, this will last. Recently, I was told one of my upper molars, tooth number 26, had a leaking filling with decay underneath, close to the nerve. I had no pain, which apparently it meant to be a good sign. So I went and had it refilled. But after the procedure, everything changed. Sensitivity, throbbing, swelling in my cheek. At one point, I even felt it near my eye. And that's when fear really set in, because I've seen what infection can do. I lost my husband Rob to sepsis. So when something like this happens, it's not just discomfort, it's fear. Part 2, the system problem. This is where the bigger issue begins. Dental health is treated like it's separate from the rest of the body. Sorry.
This is our...
We have Medicare in Australia, but not for teeth. So Medicare is in Australia, it's where our health is covered, like public health, but Medicare doesn't cover teeth. So, yet, infections don't stay politely in your mouth. They can travel, they can escalate, they can become life-threatening. I've been told I need root canals, crowns, thousands of dollars of work. My youngest son, he is so much younger, and his situation is worse. Repeated infections, severe anxiety, needing general anesthetic. But the public system doesn't easily offer that. And the private system, it's simply unaffordable. So, what happens? People delay treatment. They live with infection. They take antibiotics again and again. And we call that acceptable? Part 3. The emotional reality. There's another layer that isn't talked about enough. Dental trauma. The chair, the sounds, the loss of control. Even as an adult, I feel it. That vulnerability, lying back while someone works on something so sensitive. And for my son, his fear is even deeper. And I understand it because this isn't just physical, it's psychological. When people avoid the dentist, they're often labelled as neglectful or irresponsible. But what if they're just afraid? What if the system doesn't meet people where they are? Part 4. Beliefs, mind and body. Now, I want to speak about something more personal. I've always believed in the connection between mind and body. I've followed people like Louise Hay who've talked about how emotions can manifest physically, and I've had my own thoughts about that. When I was a child, about 10, my parents owned a shop and we weren't allowed lollies, so I snuck out at night and I took some. A couple of years later, nearly all my molars needed fillings. And part of me has always wondered, did that moment start something? But here's where I've really had to reflect, because while I believe our thoughts and patterns can influence our health, I don't believe it's so simple as you caused this. Life is more complex than that. Bodies are complex. Systems fail. And sometimes things happen despite our best efforts. Part 5. The alchemy of pain. So, what is the alchemy of pain? It's not about pretending pain is a gift, because when you're in it, it's not spiritual, it's not enlightening, it's uncomfortable, it's frightening. But what pain can do is strip things back. It removes the illusion of control. It forces you to look at your health, the systems around you, your beliefs, your fears. And in that space, something shifts, not because pain is good, but because it demands awareness. Closing. This experience has shown me two things at once. We need better systems, better access, better support for people, especially those who are vulnerable. And we also need compassion for ourselves, for others. Because behind every dental issue is a person navigating fear, cost, and uncertainty. This isn't just about teeth. It's about how we treat pain in our bodies and in each other. Thank you very much beautiful, beloved souls, for watching. Please drop comments respectfully. How are your teeth? How is your mental health? And if you needed dental work done now, can you afford it? Also, do you, like me and many, many others, have dental trauma and dental anxiety? All right. I'm going to try later tonight to do, if I'm up to it, a paranormal video. As I said, it's 6 years since Rob died. Please take care of yourselves. Be kind to each other. Love, light, and blessings. Bye.